Okay. Hello, everyone. Thank you for participating in today's Zoom meeting on aquatic exercise applications for Pompe disease. Today's guest speaker is Dr. Kendra Lucas. Dr. Lucas is an aquatic physical therapist at Kettering Health in Ohio. She specializes in the treatment of chronic pain and management of chronic and genetic conditions. Dr. Lucas is excited to share her success stories utilizing aquatic exercise in the treatment of Pompe disease. You can send questions at any time by clicking the Q&A feature at the bottom of the Zoom window. We will be answering questions at the end of the presentation. If you have any issues, technical or otherwise, please send those in the chat box. Thank you, and Dr. Lucas, I'll turn it over to you.
Wonderful. Thank you so much, Tiffany, for the warm introduction. And I'm going to go ahead and share my screen. Let's see here. Okay. Can everyone see that okay?
Yes, it looks great. Thank you.
All right, that sounds good. All right, so welcome everyone. Thank you so much for joining me today. I am so excited to be here to share about one of my favorite things, aquatic exercise. And I'm the mermaid. I graduated from the University of Dayton with my Doctor of Physical Therapy degree and went on to specialize in aquatic physical therapy. I am also a certified wellness coach. I use a whole person treatment approach in my practice to target both the body and the mind. I specialize in treating people with chronic pain and genetic conditions. And recently I treated a patient with Pompe disease and thought, I wonder if other people would be interested in learning about this too. And reached out to Marsha and met with Marsha and Tiffany, and here we are. So very exciting. And as a disclaimer, in this presentation, I cannot provide individual medical advice. The information provided here is generally for late onset Pompe disease. Please discuss options with your healthcare provider before starting any new management or treatment approaches, and I do not have any conflicts to report. So today we will explore the different properties of water and how we use those to our advantage during aquatic exercise. You will learn about the unique benefits of aquatic therapy and the physiological effects of immersion on your body systems. You will see various aquatic exercises and different pieces of equipment that may be helpful in addressing impairments associated with Pompe disease. Safety is important. We will spend some time discussing safety precautions and contraindications for safe participation in an aquatic exercise program. Before we dive in, I want you to take a moment and think about your current exercise routine. This could be a physical therapy routine that you do, or just your daily routine. What does that look like for you? So maybe you don't have a routine. Maybe you're trying to exercise, but you're not consistent. Or maybe you try to exercise, but end up having more pain or feel completely exhausted afterwards. You're not alone. A lot of my patients come to me because they've tried everything else and they can't seem to find anything that works. Even the patient with Pompe that I saw had tried traditional therapy and it made it worse. So maybe you can relate to that. I hear a lot of my patients say, I wish someone told me about aquatic therapy sooner. It is my mission to get the word out about a safe and effective way to exercise with less pain and less fatigue. Just add water. So this is our therapy pool at Kettering Health in Ohio. It's kind of like an oversized hot tub, only 4 foot deep. And there are even fancier pools out there now with underwater cameras and treadmills. built in, and the use of aquatic exercise has been around for well over 100 years. It started out as more of a passive modality, soaking in tanks for treatment of cerebral palsy, and it played a large role during the polio epidemic. Aquatic therapy has significantly advanced over the years because of its unique therapeutic environment. Aquatic exercise is beneficial for a variety of patient populations. Over 30 years of research demonstrates that aquatic exercises are beneficial for reducing pain and disability in many musculoskeletal conditions, including low back pain, osteoarthritis, fibromyalgia, and rheumatoid arthritis. Improvement in postural stability in Parkinson's disease. Neuromotor benefits in the functional daily life and well-being for people with muscular dystrophy. Improved pulmonary function in the aquatic exercise group for people with spinal cord injury. Improved walking in patients post-stroke. And improved walking speed, arm function, memory, mental health, quality of life, reduced fatigue and pain for people with multiple sclerosis. Everything is easier in the water. You have freedom to move. A lot of times pain-free too, because the water offloads your joints. You can practice functional activities that you may not be able to tolerate on land, and you can work on walking and balance without fear of falling. The warm water reduces muscle tension and promotes relaxation. So how many of you are wanting to get in the water right now? So let's explore the different properties of water. Starting with thermodynamics. So the ideal water temperature for aerobic exercise is between 82 to 86 degrees Fahrenheit. For therapeutic exercise, it is recommended between 91 to 95 degrees Fahrenheit. And we keep our pool at 93 degrees. So yes, I have the best job ever. Hydrostatic pressure. So the deeper you go, the more pressure there is. In this picture, what part of the body do you think will experience the most pressure? It's the feet. Pools are kind of like giant compression stockings. If you are standing in a 4-foot deep pool, the pressure on your feet is equivalent to wearing about 90 millimeters of mercury compression stockings. So as you can imagine, this helps with edema and lymphatic drainage, which leads to improved circulation, better range of motion, and better healing. Buoyancy gives you that feeling of weightlessness. It's that lifting effect. The deeper you go, the more offloading of your joints and body weight occurs. For example, if the water comes up to your hips, that's only about 50% weight bearing. If you are neck deep in the water, you're only about 10% weight bearing. So in aquatic exercise, instead of using ankle weights for strengthening, we use them to decrease the effects of buoyancy. For example, if someone has weakness in their legs, they may be pretty wobbly and have difficulty staying upright. So one thing that we do is we add the ankle weights to help keep them grounded and have better control and better body position. So these are only 2.5 pounds each, and they make a world of difference when we're talking about decreasing the effects of buoyancy. Density. So when you are in water, it gives you more of that rich sensory experience. And that is because water is 700 times more dense than air. So simply put, things denser than water will sink, and things less dense than water will float. So people with more body fat will tend to float more easily than those with more muscle mass. In this example, the noodle under my hips helps keep me from sinking and makes it easier for me to do the frog kick exercise. We also use neck collars for our floats, which is everyone's favorite thing. And this allows you to lay on your back in the water. In the float, we can do exercises, stretching, and manual therapy, massage techniques. I do this one technique where it's called the $1 million stretch, and kind of swaying people back to side. And yeah, just like to alleviate that muscle tension in your back. So yes, we can use these neck collars for our floats to kind of provide you some more support as well. So resistance. So we use the water to build strength. Every movement you make in the water is resisted. So it's honestly a full body workout. There are a few different components of resistance that I will mention. Viscosity is that thickness the water provides when you move. Drag is the force creating that heaviness feeling. Turbulence is the water current. So if you walk in the water and you turn around 180 degrees, that turbulence is going to give you more resistance. Speed. So the faster you go in water, the more resistance. The slower you go in water, the less resistance. So these are our dumbbells or water weights that we use. And unlike weights in the gym, these are not 3-pound, 5-pound weights. They're actually very light. And what makes the difference is the density of the foam. So if you look, you can see like the red ones are much smaller compared to the blue ones. And of course, the blue are the heaviest. They have the most, the thickest density of that foam. So it's going to be much more difficult, much more of a challenge to press those down in the water. So that's kind of how we gauge our resistance. Okay, so here are some other examples of aquatic exercise equipment. We have on the left side, we have our fan paddles. I typically use these for core strengthening, which you'll see later. And it's also great for upper body strengthening. Next, we have the buoyancy cuffs. That is really great for hip strengthening. You can attach those to your ankles and provide some extra resistance that way. And those are also great because they are buoyancy cuffs. You can also float in those as well. So awesome. And then we have the fins. These are really fun to walk in. And the washboard on the right side, this is great for core strengthening. Just picturing holding that washboard under the water and then pushing and pulling. That is a great core strength exercise. And the work comes from having to hold that board under the water. So those are some examples. Let's take an exercise and we'll kind of go through this together with a forward lunge. So we'll go from mild to wild with our progressions here. So you can actually be in a float and practice pushing off from the pool wall with your feet. And that is a great strengthening exercise for your legs. And standing, you can hold onto the rail for support. And for an extra balance challenge, you can stand out in the middle of the pool and then try to alternate your feet. Go one and then the other one, and that's going to challenge your balance and coordination. And then you add some resistance. So in this picture, we have the fan paddles that we are using for that resistance. And then we can increase the speed to increase that challenge for the body. And this exercise is great for balance. It's great for trunk control, strengthening. So really what I want to get across is that aquatic exercise is not just taking land exercises and putting them in water. We use the properties of the water for our aquatic exercises. We use those properties to our advantage to create strength, balance, and overall health. So now let's see what happens to your body when you get in the water. So we are going to take a look at the effects on the musculoskeletal and the respiratory systems. So just by getting in the water, your blood pressure and your heart rate decrease just by getting in. And so that's going to be great for people with hypertension. It automatically calms your body down. So it's also going to, the blood flow to the muscles doubles, edema decreases, circulation increases, unloads weight-bearing structures, promotes relaxation to tight muscles. The water increases the work of breathing by 60%. With every breath, we are going against that water resistance. And this is where we get that respiratory muscle training. Very important. Okay, so how does this apply to you? We know Pompe disease results from an enzyme deficiency. Normally, the body uses this enzyme to break down glycogen and convert it to glucose, and that's going to fuel the cells. However, this creates a storage problem, and the glycogen starts accumulating in tissues, particularly in skeletal, respiratory, and cardiac muscles. This leads to progressive muscle weakness, initially involving legs, trunk, and muscles around the spine, followed by arms and lower parts of the legs. So that's going to affect our pelvic girdle and core muscles, posture muscles, which may lead to kind of the winging of our scapula, and walking and breathing difficulties. Aquatic exercise can help with all these things. We can preserve muscle strength, avoid deconditioning, optimize endurance, reduce pain and fatigue, promote that upright posture, prevent those contractures, and improve mental and physical well-being. So I have created an exercise list, and this will be posted on the website, or you can scan the QR code or go to the website link that is listed on the screen. There is a specific access code for you. And so I have created an exercise template, and essentially this lists out 32 different exercises in the water that I think are excellent exercises and highly recommend to give you a starting point, right? Okay, so now what we're going to do, now these exercises, I broke them into different categories that are most important. So we want to target breathing, endurance, core strength and stability, hip and arm strength, balance, posture, flexibility, and mobility. So let's start with the breath. I recommend diaphragmatic or belly breathing. You can also incorporate your breath with the exercises. So this breath is going to reset your nervous system. It's going to activate that parasympathetic response. So that is going to be a natural muscle relaxer for you as well, just by breathing. And we are improving the strength of respiratory muscles. So I Chi is kind of like Tai Chi in the water, and that is going to incorporate movement with your breath. So I do have a series of I Chi movements listed on your handout. So, and that also has the ability to have a video. So you can watch the video of that as well to kind of understand the movement patterns. So that's very relaxing, and it's incorporating that respiratory strengthening. So water walking, there's lots of variety with water walking, and you can walk forward with opposite arm and leg. You can walk sideways and have your angel arms, so going out and in with your arms. backwards. So you can hold the dumbbells down by your sides and try to walk backwards. And a couple other ones. So march walking. One idea is to incorporate an opposite knee tap. So tapping opposite knee as you walk will be a little bit extra challenge for your balance. So the straight leg walking, I kind of call them Frankensteins because that's what it looks like for me. It's really a nice hamstring stretch as well. So you're just walking with straight legs through that water. And I tend to put my hands on the hips just to monitor what's happening at that hip level. Can you keep your hips, your pelvis level, or are you kind of wobbly? Is it more of a challenge for you? So that's a fun one to try. And then for more balance, the tandem, that heel to toe walking, kind of like you're walking a tightrope, is really great for balance challenge. So just some ideas. All right, so back and core strength and stability. This is my absolute favorite series for back and core strength. So we have really out to the side. You're going to almost kind of picture like you're squeezing your armpits together. As you press down through the water, that's going to be that first movement. Then you turn the paddles up and down, and you're going to squeeze them in together in front of you. Now, you don't have to use paddles with this. You can just use your hands, and that creates some resistance as well. And then the last one in the series is just pushing both down in front of you. So very awesome exercise series, and you can increase the speed to make it harder, that sort of thing. So I have listed on your handout some of those regressions and progressions that you can look at depending on where you're at. So next we have our core noodle press. So the setup for this, you put your back flat on the pool wall. You connect your shoulder blades to the wall. And then we all have a little curve in our low backs. That's what we want to try to put against the wall. So practicing a little pelvic tilt and placing your back flat on that wall. So that in of itself, you can practice that pelvic tilt to kind of get that core activated. Then what I like to do is just push that noodle down 1 inch, and you'd be surprised. That is going to really challenge the core muscles. You may even feel like you're going to float up, and that is really going to be awesome to activate your core, because some of the land exercises for core strengthening, it's kind of hard to find those muscles sometimes. And in the water, just by using a pool noodle, we can activate the core just by pressing the arms down. So very exciting for our core press. Now, to take this up a level, you would push it down all the way. So pressing it down to your knees and then back up. How to incorporate the breath with this, you would breathe out as you press down and inhale as you release. So wonderful exercise. Okay, so plank, this is excellent for core strength and posture. So you want to reach the arms, you want to stack where the shoulders is with the swim bar. So you want to have that swim bar directly under your shoulders. And so you're in kind of like a push-up or plank position. And now with your inhale, you're going to reach the arms up to the surface of the water. Exhale, pull down so it's right under your shoulders again. So you can hold this and then maybe work the legs a little bit. Maybe do some leg lifts from this position. If the swim bar is too much of a balance challenge for you, you can modify this by placing your hands on the pool wall or rail for a little bit more stability support. So that is a way to challenge your core and your posture. So arm strength. I have pictured here on the left side, the bicep curl. You can do them both at the same time, or you can do one at a time, changing the resistance level to what's appropriate. And then we have arm circles. So kind of circling the arms, getting the shoulder mobility loosened up, everything like that. So really good one to for your arm strength and mobility. You can also add a little bit of a balance challenge just by changing your feet position. So by putting your feet closer together, that's going to challenge your balance versus if they're a little bit wider out further apart, that gives you a wider base of support. It's a little easier. So those are some ideas for that. We have hip strengthening. So this left side picture, really what this is a march connected with a hip extension. So you can add a trunk lean as well with this one. So the march component and then swinging the leg behind you, march and then swing the leg behind you. So that's going to be great for balance and for that hip strength. The hip abduction, adduction, that's going to be our side kicks. So you're going to kick the leg out to the side about halfway. And then really what the work is pulling it in a little bit faster. So out, controlling it out, making sure you're not leaning over to the side, and then pulling it in a little bit faster for that challenge. You can do this in a float too. So you can do essentially like a snow angel in a float position. And that's really going to work your hips. All right, so the hip hinge squat. So practicing getting in and out of a chair easier, essentially is what this is. So we're going to pretend like there's a chair behind you and you don't really know where that chair is. You're going to reach the hips back, bend the knees, and have the arms reaching in front of you. As you stand, push with the feet, stand up. And you can incorporate the arms as well, reaching and then pulling down if you want some posture work. So there's endless possibilities for the modifications and the work that you can do with aquatic exercise. So very exciting. You can do this holding onto a rail. So lots of options for you. Okay, so this left picture is to challenge your balance. So I call this the noodle leg press. And you just have a noodle under your foot and you're going to control it up to a march and then stomp it down. And try to repeat that as many times without falling over. And that is going to be great for your balance. You can increase the size of the noodle if you want more of a challenge. That is the challenge here is not to go past that 90 degrees. Otherwise, you're going to feel that kind of pushing you back. So it's really about the control and then the power as you press. So very fun. And then this picture on the right is actually Warrior 2 in aqua yoga. So very fun for posture, especially. It also incorporates the breathing as well. So that is a picture of some aqua yoga. I think in your handout, I also have like a cat-cow for some back mobility and things like that, which is part of that aqua yoga as well. Flexibility. It's amazing what you can do with a pool noodle. Honestly, it's so fun. And this picture on the left is a hamstring stretch combined with a nerve glide stretch. So you put the noodle under your leg, the noodle holds your leg up, and all you're going to do is pump the ankle, just flexing the foot, point the toes down, flex the foot up. And that's going to give you a nice pull and stretch for your hamstrings, just using the buoyancy and to kind of stretch your hamstring out. And then what you can do is open the leg out to the side to get a stretch from the inside of the thigh, and then crossing it over to stretch the outside of the hip. So that's also going to get the IT band that goes from the hip to the knee and get that stretched out as well. So just going back and forth, that's going to be an excellent flexibility stretch for your legs. So one thing is posture-wise, that feeling of being pulled forward. And what that does is it shortens your hip flexors. And so to stretch that out, you can use a pull noodle on your leg. And sometimes people will get some cramping of the hamstring with this. And if that happens, you don't have to use a pull noodle. You can just curl your leg behind you and then put it back down. Incorporating actually a hamstring curl, just curling the leg up and putting it down. You don't want to push the noodle all the way down because then it'll end up between your legs. Just halfway down, press and release. And that's going to stretch your hip flexors, the front part of your hip, to give you better posture and help you walk better. You can hold this just as a static stretch and recommend at least 30 seconds for maximum benefit here. Okay, so let's talk about safety. So the number one place for falls is getting in and out of the pool. So we have a chair lift at our facility. Our chair actually goes up to 500 pounds. So we have a lot of flexibility there to accommodate a lot of people. And another reason why you may want to use a chair lift or look for one at a facility is really energy conservation. So using your energy in the pool versus getting in the pool. So kind of monitoring that energy level is maybe a reason why you want to use the chair. As a general safety rule, never get in the pool alone. So have your therapist there, have a workout buddy, that sort of thing. Do not get in a pool by yourself. Too many risks and it's not safe. Okay, so precautions and contraindications. So this is a checklist. We go through this with all of our patients to make sure they are a good candidate for aquatic therapy. We don't have time to go through every single one of these things. Of course, your aquatic therapist would be asking you these questions, making sure that you are a good candidate. I'll highlight some of the ones that you may be thinking about. So if you have seizures, pool therapy is probably not for you. The big risk is having a seizure in the pool and drowning. And if your seizures are controlled and you haven't had one in at least 3 months, then maybe it's a consideration depending on the type of seizures you have. There are more risks, of course, and precautions that we take as a therapist too, just from a safety standpoint. So if you have a feeding tube, the risk is pool water getting in, and that's going to increase the risk of infection. So it's also possible with the exercises that you're doing that the tube could accidentally get dislodged. And I typically, what I do is put a waterproof dressing over the site to keep it dry. And it's also going to contain it, so it decreases the risk of it, dislodging with exercise. If you wear supplemental oxygen on land, then you wear it in the pool. My recommendation is to get an extended hose and keep the tank poolside on the deck. I see a patient with post-polio syndrome and he wears a BiPAP, and we actually use a thicker, more supportive collar when we float, which works out well, adds a little bit more support for the neck and airway. He wears his BiPAP the whole session. We do have a pulse oximeter that we keep poolside, and you can monitor your oxygen saturation and make sure that's staying in the normal safe ranges with exercise. So there is also a risk for respiratory infections. However, there is also benefit for respiratory muscle strengthening. It's really all about risk versus reward. So do the benefits of you exercising in the pool outweigh the risks? So I recommend aquatic exercise 2 to 3 days per week for 30 to 45-minute sessions. And give yourself a recovery day after pool sessions, avoid back-to-back days, and just notice how you feel. So how is your energy? How is your energy level for the rest of the day, for the next day? And, sometimes people are feeling so good in the pool that it's kind of like the happy hour effect, where you're feeling so good that you just so happen to run like those other 3 errands that same day, and then you kind of pay for it the next day. So kind of figure out where that zone is for you, and how you're feeling, how your energy levels are, and you can kind of modify what kind of exercise that's appropriate for you. I do recommend light to moderate exercise. So light activity means you can easily breathe and carry on a conversation. Moderate activity means you may be breathing a little heavier, it's more of a challenge, but you can still hold a short conversation. So anything more than that, where you're not really able to get your words out, you're overdoing it. So just back off a little bit and that sort of thing with your activity. So that would be my recommendation. So knowing what you know now, what do you think you'll do next? Find an aquatic physical therapist, of course. So you can go to aquaticpt.org, and under the patients tab, you can click on Find a PT, where you can search to find one near you. And if you're wondering where to buy aquatic therapy equipment, I recommend theraquatics.com. And Swim Outlet is a great place for swimwear. They also have other things, equipment, water shoes, those kind of things. And I personally use Aqua Design. So the shirt that you saw me wearing in the pictures, that was Aqua Design. So very comfortable and chlorine resistant. So I'm in the pool every single day. So that really does hold up well for me. And if you now just want to buy or want to build your own therapy pool, that's literally the dream, then SwimX and HydroWorks are my recommendations to look into that. So here are my references. And may you feel strong as you move forward. And thank you for being such a wonderful group. You can connect with me on Instagram at Kendra Mermaid PT or at Mermaid Well. If you have questions or comments, feel free to email me at kendra@mermaidwell.com. And it looks like we do have a few minutes for questions. So if you have a question, now is the time to put it in the chat. Love to hear from you.
Thank you, Kendra. This has been a fantastic presentation, and I think you really explained everything well. There are a couple of questions. One patient wants to know, do you do virtual visits or like telehealth type visits for out-of-state patients? He says he knows some states allow it and others do not.
Yeah, so great question. So how telehealth works is wherever our patient is, that's where we have to hold our license. So I only have a license to practice physical therapy in Ohio. So I'm a little bit restricted with telehealth for that reason. Okay. So the recommendation would be to follow that link online to find an aquatic physical therapist near you, and that sort of thing. And some people, if they have access to a pool, sometimes I will see people, even if they're traveling to see me from, several hours away, just kind of put together an exercise program that's individualized for them, making sure that they're good with it, and then they're good to go. So sometimes I see people to just develop kind of an exercise program versus most of my patients I will see for a 3-month period of time, and we will work together and see progress over that period of time. So great question.
Do you have centers in Canada, or do you know of centers in Canada?
Centers in Canada.
Yeah.
What is the question regarding that?
Well, they're from Canada and they're interested in finding an aquatic therapist.
Oh, I do not know of anybody. That would be a great question. Yeah, I do not know anybody in Canada that practices physical therapy.
Do you think any of the links would help to locate or through your network?
Yes, that so you could contact the Aquatic Physical Therapy Association. It'd basically be that same website, and then you could contact them directly and see if they have questions, if they have resources. But me personally, I do not know anyone in Canada that practices aquatic therapy. We need more people.
Yeah, definitely. And are those links in the handouts that you provided?
Yeah, so this is, yes, the link. Oh, wait. Here it is. The Find Aquatic Therapist. So APTA Aquatics website is aquaticpt.org.
Mm-hmm. Was that, but you sent some handouts for us to post afterwards.
Yes, so it's all of my PowerPoint slides that you will be getting.
Perfect.
And then the 32 aquatic exercise handout that it is through MedBridge, which is what we use for our prescription of aquatic exercises. So I put together a template basically of some sample exercises that I think would be very beneficial for this group.
Thank you. Then another question came into me by email. Do you have any recommendations on how to get it approved by insurance?
So
Because,
yeah.
I think this patient has had a really hard time getting it approved.
Oh no, yeah, it's covered by traditional insurances. So depending on, so I don't know what, it might just be that certain insurance coverage wise. Do you know what? Yeah, I know. What did we have a trouble with? Like Anthem. I think it was Anthem that we had. Like they would only approve like 4 visits, and then we'd have to ask for more, and then go through this whole game of insurance.
Yeah. Would
So
you
sorry.
Do you think you could help write appeals letters if it came to it?
Appeals letters would come from your physical therapist that is treating directly. I've written plenty of those, and I've got on the phone call with insurance as well. And that's something that comes directly from your provider to advocate for you.
Okay, thank you.
Yeah,
and this particular patient has Medicaid, Medicare. So
I hate to hear that. But traditionally, aquatic therapy is covered just like you would a normal physical therapy visit.
perfect. And then we have another question. We have some physicians in our community that collaborate with other physicians out of state because the patient is not able to travel. If a patient finds an aquatic therapist in their area, would you be willing to share best practices and collaborate?
Oh, absolutely. Yes. And you could even share this presentation and the handout with the therapist there. And So there is, some additional training through the Aquatic Physical Therapy Academy to become certified in aquatics. So that's the training that I went through. So you could ask them because they would be super knowledgeable about, especially like the manual therapy techniques that they train heavily in the course. So not all physical therapists go through that certification, that practice in aquatic settings. So yeah, most certainly I love collaborating. So I'd be happy if you want me to talk to your physical therapist and collaborate that way and share ideas. You have my contact information.
Thank you.
Yeah.
Is it possible to purchase some of those items you mentioned so that we could use them ourselves, like the collar and, okay, so that's where you purchase.
Yes, so that is going to be under the resources. So we typically buy our aquatic exercise equipment on theraquatics.com. So check it out. There's so many fun things. But yes, as far as what the aquatic fan paddles, I feel like I use that all the time. Such a great piece of equipment. Honestly, a pool noodle, you can do so much with a pool noodle, and that's only going to cost you a couple dollars. So very good.
Now I've got another question from a patient that is more severely affected. So completely wheelchair bound, unable to really stand or anything. And they also have a jacuzzi. Would it be possible to do some of these exercises modified in a jacuzzi?
Yeah, so excellent question. So that's awesome that you have a jacuzzi, jealous. So yeah, the only problem is any temperature above 95 degrees is unsafe to exercise in. So some of those jacuzzis and hot tubs, you're able to adjust the temperature manually. If your jacuzzi has that ability, then you can place that temperature between 91 to 95 degrees, and that would be safe for exercise. If it does not have the ability to adjust the temperature, then it's not safe to exercise. Primarily, the reason is you get dehydrated. You don't really notice that you get really dehydrated when you're exercising in warmer water. And so that would be my recommendation.
That's great to know. Thank you.
Yeah, of course. Great question.
Does anybody else have any other questions for Dr. Lucas? This has been a really informative, fantastic presentation. Oh, somebody wanted to know the exercise plan on the MedBridge Go app. Is it a free? Is it free?
Yeah, it's free. Okay. And you don't have to have the app to access that because I've just basically created the PDF version. If you want to see the videos specifically, then you can go to the website or download the app and use that access code. And you're going to be able to view the videos and pictures and that sort of thing.
Thank you. Well, you've had a lot of people in the chat say thank you. They really appreciate it. And it's been an incredibly helpful, informative presentation.
Wonderful. Awesome. Happy to share what I love, and that is the water.
And then one final question. Do you have suggestions for equipment other than the pool noodle for people that are very severely affected and have very limited mobility?
Yeah, so the neck rest, the neck collar is going to be the absolute best piece of equipment because that's going to be protecting your airway better.
Is that something that somebody that is trach could use?
Who is what?
Has a tracheostomy.
Oh, the trach. Mm-hmm. Oh, I see what you're saying. Just kind of like,
Mhm.
yeah, you can definitely, of course, like the risk versus reward, right?
Right.
So is it going to be beneficial for you to be able to exercise
Mhm.
and versus, the risk of you aspirating water, getting infections. So there's definitely a risk with that. You'll have to play with positioning as far as like where the neck collar hits, and that sort of thing. In the handout, if you have a therapist that is trained, then they can rest your head on their shoulder and that sort of thing. So that's what I've done in the past to protect the airway effectively.
What about using like a lifesaver ring, like they use on boats and stuff? I mean, you lose the ability to do some of the arm movements, but for like,
Oh yes, they have. I've only seen it with children. They have like this makeshift noodle PVC pipe device that's
Mhm.
essentially a water walker, and that allows you to be independent in the water when you're walking, and things, and gives you a little bit more trunk control. I haven't really seen one for adults. Not that it doesn't exist. That's just something that I've only seen with children.
Okay. Thank you very much.
Absolutely.
Are there any final questions that people have? Well, we have Dr. Lucas. Okay, it looks like that was all the questions and we're a little bit under time, but I would like to thank Dr. Lucas very much for this fantastic presentation. And with that, this ends today's webinar, and we want to thank everybody for participating.
Thank you.
Thank you.